Hi, I'm Tom Clark, and welcome to Medical Minutes. It's a staggering statistic. According to the American Heart Association, more than 82 million Americans have one or more types of heart disease. That's 1 out of every 3 adults. Chances are that heart disease has touched you or someone you know. In recent years, the medical community has made great strides in understanding the causes of heart disease. Increasingly, they're finding that things you do today can impact your heart health both now and later. I'm pleased to be joined by Dr. Manfred Sandler, a board-certified cardiologist and the medical director of cardiology here at Gwinnett Medical Center, to learn the keys to a healthy heart. First of all, welcome, Dr. Sandler. We've all heard the phrase cardiovascular disease, but what exactly does that mean?
Well, cardiovascular disease remains the #1 killer of people in America, unfortunately.
So I understand that eating is probably one of the major factors.
Well, eating healthy, even small amounts, is definitely to the advantage of the patient. When we're talking about eating, we're talking about eating healthy foods like fruit, vegetables, fish, cutting out sugar. What's recommended by the American College of Cardiology is that you have 4.5 cups of fruit and vegetables a day, not more than 1,500 milligrams of sodium intake, fish, preferably oily fish, 2 helpings a week. You don't have more than 450 calories or 36 ounces of sugar-impregnated drinks per week. And lastly, that you have 3 helpings of whole grain fibers daily.
Now, I know a lot of that goes along with watching your weight and staying active too, right?
Weight is as equal as eating. In other words, take control of your weight. We have an epidemic of obesity in America. You need to get out there, exercise between 15 and 30 minutes at least 5 times a week.
And I know we've heard it, it's been pounded into our head, smoking can't be good for you.
Smoking is a no-brainer. I mean, it says it on the package insert, just read the package insert. People need to quit smoking. Even if they've tried before, they need to try again.
What about stress? We're constantly hounded by things every day all around us.
Well, it's hard to lead a stress-free life, but there's certain things that I would recommend from a stress point of view to downtone the stress. One is exercise. We've already discussed that. The second one is take time, spend time with your family, spend time with your friends, do your hobbies, relax.
Now, is there anything else? I've heard some talk about numbers. When we talk about numbers in cardiovascular disease, what exactly are we talking about?
Well, that's a great question. Patients or people have to take ownership of your health, and one way of taking ownership of your health is know a little bit about yourself. Know what your blood pressure runs, know what your heart rate runs, know what your cholesterol runs. Ask your doctor these questions. It's your body.
We've got our 6 factors, and I think what you covered. We've got watch what you eat, manage your weight and stay active, definitely no smoking, manage the stress, and then numbers. What else can you tell us?
Well, nothing is fully preventable. Unfortunately, if you do happen to think you're having a heart attack and you do have the classic symptoms of chest pain, pressure, shortness of breath, cold sweats out of the blue, don't drive yourself to the hospital. Call 911. Gwinnett Medical Center has furnished ambulances with a program called LifeNet, which allows you to transmit EKGs into the hospital, so the emergency room will have all the information they need before you arrive. Do not drive yourself. Call 911.
Thank you very much, Dr. Sandler. We appreciate it very much.
Thanks, Tom.
All right. Gwinnett Medical Center offers a full continuum of heart care, from diagnosis to treatment to cardiac rehabilitation. Now, if you'd like to learn more, visit gwinnettmedicalcenter.org/cardiac. For everyone here at GMC, I'm Tom Clark. Remember, when you need current, accurate information, check out Medical Minutes at gwinnettmedicalcenter.org.